Canabis, marihuana, maconha, small pot nos Estados Unidos, baseado. Essas são as várias formas que nos referimos à erva e que é tão discutida e que ainda hoje se fala em sua liberação completa, se vai ser crime, se não vai ser crime. Mas afinal, essa substância é uma maldição ou uma bênção? Nosso convidado de hoje é um importante médico jamaicano, vejam só, que se dedica a esse estudo e coloca reflexões que devem ser debatidas sob a ótica científica e médica, sem ideologias e sem nenhuma conotação política, ou seja, com maturidade. Dr. MacDonald está no Brasil para participar do 38º Congresso Brasileiro de Medicina do Exercício e do Esporte, para falar sobre o uso do que se entende por entorpecente no esporte. É um médico importante em seu país, inclusive com atuação em várias entidades desportivas internacionais, inclusive na nossa Pan-Americana, e vasta experiência. Afinal, marijuana is a blessing or a curse? Não podemos também nos esquecer de dar o seu like, de compartilhar, de contribuir, é muito importante para ajudar o nosso canal, né? Se inscrevam, dá seu like, participe do programa, porque aí isso nos ajuda a dar relevância, né? Dr. MacDonald, que nós vamos conversar hoje, é um eminente militar, é um capitão médico, e ele tem várias atuações em confederações como o rugby, e ele acaba, inclusive, de passar aí por um problema muito sério em seu país, que ele vai falar conosco aqui no nosso canal. Dr. Andre MacDonald, welcome.
Thank you, Dr.
How are
Santi.
you?
I'm good. I'm great, Santi.
Great.
Very, very good.
Okay, are you happy to be in Brazil?
I am.
Is your first time?
It is my first time. I am very, very happy. Right? I probably might not leave.
Yeah. Maybe we can. You're not married. Maybe we can find a Brazilian wife. What do you think about?
Maybe we can. That's a very good thought, Santi. I like that thought.
Good, doctor. And Dr. Andre, he has a radio broadcast in your country, right?
Yes.
He talks about health and other problems.
Oh, yes.
Tell us about.
Yes. It is called Prescription for Life.
Prescription for Life.
Yes,
Interesting name.
Interesting name. As a young doctor, I noticed that when many persons came to the doctor, the only thing we could do when we wrote a prescription was to give them some medication for a few days. But I realized that if you can give people knowledge and teach people how to approach life in a healthier way, a more sensible way, then you will give them a prescription for life, not just for a day. Yeah. And therefore, I decided to start this radio program.
It's much more than prescribe a medication.
Oh, yes.
Much more.
Oh, yes.
It's further about that subject, right? But listen, tell us about yourself. Where did you graduate in medical school? And what are your qualifications?
Yes.
Tell me your medical story.
Oh, yes.
Well, first, your personal story. You were born in
Kingston, Jamaica.
Yeah.
Yes. And I always liked sports. From I went to elementary school, I was playing sports. I played football and I played cricket. All the time.
Cricket is very popular in your country.
Cricket is very popular. Very popular not only in Jamaica but in the West Indies, which represents the number of countries in the Caribbean. And we come together to form what we call collectively the West Indies. Mm-hmm. Cricket is our number one sport in all of the West Indies. Yeah. In Jamaica, our number one sport is track and field. Everybody knows about Usain Bolt. So Jamaica, if you go to Jamaica, Jamaica is music and sports. Have you ever heard about Bob Marley, Santi?
Yeah, Bob Marley.
Yeah,
I love Bob Marley.
So if you the two most popular persons ever to have come out of Jamaica are Bob Marley and Usain Bolt.
Yeah.
So Jamaica is music and sports.
Like my program here is music and sport and medicine.
Yeah.
So
There you go.
yeah, you're in the right place, right?
Oh, well, there you go.
Yeah.
So as a child, I did sports. I did football, cricket, track and field. So I can run very fast. I was a sprinter. I also was a wicket keeper batsman, and I also played football. I played many positions on the football field.
Oh yeah.
Yeah, and I'm also a musician. I sing Santi, and I also play the drums.
Yeah, like me.
Yo,
yeah,
there you go.
Yeah.
There you go. So that
Yeah, you see that we have a drums here.
Oh, okay.
Okay. Yeah.
Oh, there you go.
We have a drum. Yeah.
There you go. There
In
you
our
go.
studio.
Yeah.
Yeah.
So I loved sports, and therefore, because of my love of sports, when I stopped playing sports in late high school, because I played cricket all the way up to the 13th grade, my mother decided that okay, she wants me to take my academics very seriously, and at that time I wanted to be a medical doctor also.
Okay.
So I did well in school. I got all A's at 17 years old. I went straight into the University of the West Indies, Jamaica, at 17 as a medical doctor, and I loved medicine, did very well, graduated in 2002 from my first degree. Did two others apart from that after I did one in ultrasonography. So I am a sonologist. And I also did another one in sports medicine.
Yeah. Okay.
So the one in ultrasonography was done in the University of Toronto, that's in Canada. And then my sports medicine was done in the University of the West Indies in Jamaica.
Okay.
So I would have 3 medical degrees. And my qualification, my main job now is to be a specialist in sports.
Okay. By the way, you know Usain Bolt is your personal friend. You told me that you met him.
I've met Usain Bolt a couple times.
Oh, yeah.
Usain Bolt is a very good guy. He's a very friendly guy. He the good thing about him is that he meets everybody he can in Jamaica, and he's always out and about. He's a good guy.
Yeah, and we cannot forget Peter Touch. Yeah,
Peter Touch is a musical icon in Jamaica.
Yeah, I know.
He has many memories in Jamaica. He has many memories. He would have, for those who would know, Bob Marley, Peter Touch, Bunny Wailer, those were all in the same era.
Yeah.
And they represented a period in Jamaica when music was the main thing that kept the people alive.
Yeah.
And the people used the music at that time as a way of liberating themselves, freeing themselves from anything else that they did not like. It was an outlet for the Jamaican people. And so Peter Touch, Bob Marley, Bunny Wailer provided something for the Jamaican people to look forward to.
And Bob Marley loved football, soccer. I remember that once he came here and he met Pelé, and he met and another important thing, there's a state here in Brazil, is Bahia, whose music is very influenced by Jamaican music. So they some rhythm. It comes from Jamaica.
From reggae music.
Yeah, from reggae music, yeah. So it's very clear that. So very strong influence, and it's beautiful. I love that reggae. When we can play, we are happy because, it's very free music and sonority.
Exactly.
I love it. it.
But Marley's first sports injury with his toe, his great toe, came from football.
Yeah. But I think he has a kind of cancer.
He got cancer. That was what led to his death.
Yeah. By the way, in this channel we have his story here.
Okay.
Yeah.
Yes.
We have it, and we talk about that.
Okay.
So people, you can look for about Bob Marley's story in this channel,
Yeah.
and explaining what happened to him, and
Yes.
even teaching how to prevent this kind of injury, this kind of
Yes.
disease. So it's
Yes.
important.
Very important.
Uh, you are here for the Brazilian Congress of Sports Medicine,
Yes.
right? How was it?
It was great. It was my first time.
Yeah.
I enjoyed this congress. I enjoyed the conference. I enjoyed it so much, Santi. I hope they will invite me again. The Brazilian people are so friendly. They are easy to deal with. I saw other lectures that were very interesting,
Yeah.
very informative. um, I was able to participate in two lectures. I spoke about concussion and I spoke about marijuana. I was very impressed with the questions that the participants asked.
Yeah.
Very, 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 very deep questions, questions that would cause you to think, but questions that show that the Brazilian people are interested in knowledge. They want to know more and they want to understand the subject and they want to know how we can use this to make our people better. I was very interested in some of the topics that were being studied, how deep and how specific these topics were, how detailed these topics were. I believe this Congress is, and it was excellently organized. It was very professional. The technology was at the highest standard. The speakers were very, very organized in terms of their timing and in terms of the translations. The translators were very good. And this allowed many persons, even though they spoke different languages, to understand. So presenters could present in one language and the people could listen in another language and the people could ask questions in one language. A lot of the questions to me were asked in your language, Portuguese, but I understood every single one and I was able to answer every single one. It was well organized. It's one of the best conferences, if not the best, I've ever been to.
Oh, thank you for your good impressions,
Yeah.
and I'm proud of it because I took part of the organization. So I'm very happy about that, and you know I thank you, my friend, and you take part of my commission, my medical commission, and Panam medical commission, Panam Boxing medical commission. So now I'm sure that I made the right choice putting you in the commission. Thank you, Dr. Andre. But we have to talk. You know, it's not a good subject, but I think it's important to people to understand because you're captain, right? You're a military doctor, captain of the Jamaican Air Force, and now before
Jamaican
you
Army.
coming, before you coming, you had a mission, a very strong mission, because a hurricane just passed through Jamaica, and you know lots of destruction and people without houses and injuries. Please talk about because I know that Brazilian people has to know about that and to you know to feel what our brothers in Jamaica felt, and people have you know it's based of many reflections about that.
Yeah. It's the most destructive, the most devastating. It is the worst hurricane
Ever.
ever to have hit
Oh.
Jamaica. It was category 5. It was remember, hurricanes stop at category 5. You cannot get a bigger one than a category 5. And so the winds were up to 195 miles per hour. These winds hit Jamaica directly, and it tore people's houses apart and tore people's lives apart. People were totally destroyed, nothing left. Up to today, this morning, the death toll is 45 lives. So 45 persons have died.
45.
45. And every day it increases because recovery efforts continue. Many people's houses were buried under landslides and mud, and many people's houses were blown away. I have friends who have not been able to find their family members yet. And the hurricane has gone for weeks now. So we almost are thinking that these people are dead, because the government has been able to put light and water and telephone back in many areas. And so by this time, you should find your family members. But unfortunately, people are still not accounted for. So we are very worried still, but we believe we will still have more deaths. It's very difficult, Santi, to wake up in the morning and everything that you have worked for all of your life is just gone.
Oh boy.
It's just gone. In a few minutes, this hurricane was so powerful. In a few minutes, it goes and it lifts your house and your cars. I was speaking to the doctors of the worst hit hospital. That hospital is called Black River Hospital in Jamaica. And the doctors told me they stood inside the accident and emergency department, looked outside, and just watched the hurricane pick up their cars and just threw it around, just destroyed it. And then after the storm, they went home and they had no house. House is gone. These are the doctors. So they had no car, no house, nothing. They're starting over from ground zero. That's how difficult it was.
As a matter of fact, you almost couldn't come because the two most important airports of Jamaica were almost destroyed, and
Yes.
almost you couldn't
Yes.
get flights to come for the Congress. And this is one more reason that I admire your work, and now my heart is happy that you came because of your efforts to reach us, and that's why I ask for prayers. Brazilian people should make prayers for Jamaican people because it's a pretty hard situation. I can't even realize because I never felt, but when you
Yeah.
tell me, my heart is very
yes.
broken about that.
Yes.
And I hope you could, go move over and go ahead and
Yes.
keep going.
Yes.
And what about the authorities, the Jamaica authorities? What are they doing about
Yeah,
that?
yeah. So the
Is helping coming from other
from
countries?
overseas,
Yeah.
yes. So there's a lot of help
Yeah.
that is coming. What we want, what we hope. There's so many persons to help, Santi. There's a lot of help coming. The help can never be enough. There's so many persons helping, but there's so many persons who need help.
Yeah.
And so many people who don't get the help in time.
Oh yeah.
So we're trying. For the last 2 weeks before I came here, I was constantly in the areas of the persons. I was there giving medical care. Santi, we're seeing over 100 patients under a tree. That's where we set up our medical services, under a tree, a big tree, because there's nowhere to set it up. And that's where we see over 100 patients under a tree. That's where you give them food, water, tissue. We just the help can never be too much. And so my organization, it's shorttimemedical.com, also gives help. So we always say, it's on our website. People can always donate anything and it gets to the people, because we constantly go to the areas to help the people, to make them better. And we want to see them better. When I get back to Jamaica, as I get back to Jamaica, I'm going to help again.
Yeah. Well, I saw you here. You were working all the time, talking to the doctors in your hospital, and
Right.
giving them information and
Right. Right.
ordering instructions and
Right.
uh, tell them what to do with patients
Exactly.
all the time. Yeah,
Yeah.
I saw by myself.
Yes.
It's pretty hard.
Yeah, we're constantly
Yeah,
working to
constantly.
Santi.
And now you're
Yeah.
going back and
And we're going
you're
back,
gonna get
yes.
to work again.
Right away.
Yeah.
Right
Okay.
away.
Well, let's talk about our subject. Our main subject
Subject,
is
yes.
about marijuana,
Yes.
blessing or a
Or
curse.
curse.
It's a very good title because you
Yes.
see, just to people to think about.
Yep.
Right? We want to just tell you wrong or right.
Yep.
Just think about, and Dr. Andre is gonna bring us informations, useful informations to understand what marijuana is in real
In
time
real,
and
yes.
in real informations.
Yes. Yes.
Okay,
yes.
go ahead, Dr. Andre. Now,
It's so important, Santi,
Yeah.
for persons to understand marijuana. You see, Santi, in life, the most important thing is understanding. You must understand. It doesn't matter what you do in life, the most important thing to do is to understand it. I believe that when you understand something, it allows you to make an informed decision, an educated decision. You can make the proper decision for yourself. And I think one of the things I try to work on everywhere I go in the world first is for persons to understand what are we talking about. Marijuana, otherwise called cannabis, is the plant, and the plant is the green thing that people sees, that people dries,
Okay.
that people roll in cigars, in cigarettes, and they use it for their own personal use. Some people smoke it.
Yeah, it's a different dynamic
Yeah.
of smoking cigarettes.
Yes,
Very different.
It's different. It's different.
Yeah.
And so people use it in several different ways. But marijuana or cannabis refers to the plant. There is something called cannabidioids, which refers now to the active ingredients.
If you want to show something, just let us know. Then we
Yes.
can put
We can put the slides on
the
on
slides
thing.
and send. Okay.
Yeah.
So, marijuana in
so-
sports: a blessing or a curse,
Yeah.
by Captain Andre McDonald.
Yeah. So let's go to number 9, page number 9, and we want to show the listeners, the members of the audience. That's it.
The definitions.
The definitions.
Yeah.
So we said before that cannabis or marijuana represents the plant itself. There are two main types of the plants. One is called sativa and one is called indica. And sativa is the one that makes you feel very good, Santi. Indica is the one that makes you feel very calm. It's so important to know the difference for many, many reasons. Cannabinoids, which represents the active ingredients, is what people call THC and CBD. The big word THC is tetrahydrocannabinol. That is the active part of marijuana, Santi, that is psychoactive. It is the one that causes the brain to feel intoxicated. So the one that causes persons to be addicted to marijuana, the THC. And if you go to the next slide, Santi.
THC is exactly the part of cannabis that is detected in doping matters, right? When you find THC in the doping sample, in urine sample, so it characterizes utilization of
That's what we test for.
Cannabis.
That's what we test
Cannabis,
for.
yeah.
Whenever we test for doping, we
Okay.
actually test for
Yeah,
THC.
okay.
Okay? And if we go to slide number 10, which is the next slide.
Number 10 is the next slide, yeah.
Then what we will
Next.
see is CBD. CBD, right, otherwise called cannabidiol, is the
Cannabidiol.
non-intoxicative, non-psychoactive component of cannabis. That's important, Santi. Why is this important? Because CBD has also some effects. But when we test for doping, we do not test for CBD.
Okay.
So CBD is legal
Legal.
to be used.
Yeah.
Yeah.
Even
if you
even
have-
sports.
in sports.
Yeah.
Even if you have
The two is therapeutic property.
yes. If you have pure CBD, it's legal. The thing with CBD is that many persons get CBDs from places that may be contaminated with THC.
Okay.
So you have to
Yeah.
be careful.
Yeah.
You have to be careful. So we have many athletes who turn up positive tests for THC, and then they told us they're using CBD.
Okay.
And when we find out where they got it from, it is a source that has not been able to separate the CBD from the THC. So we ask athletes to be very careful that they get the CBD from a regulated source. Regulated means the properties of the CBD has been tested. It has been tested for contaminants like THC, like pesticides, like heavy metals, things that will turn up as banned in a doping test. That's what regulated means. Regulated means it is usually government monitored. That's what is important.
Monitoring. Yeah.
As opposed to getting it from an unregulated source. Because unregulated sources, Santi, usually have contaminants. They're contaminated. Unregulated source usually has THC in it. An unregulated source are sold by persons who have no license to sell, who are unregulated, who just wants to make money. They do not care about athletes. So it's very important that we understand that we get CBD, if you're going to use CBD, from a regulated source. That's very, very important, okay? If we look, Santi, at slide number 12, okay? It's so important that you understand that the marijuana can be used via several routes.
Okay. That's important information.
Yeah. So it was so important because most people know marijuana as just being smoked. The majority. Did a survey where I asked persons, even in my country, how is marijuana delivered to the body? And 78% of persons just knew smoking because they think marijuana can only be smoked. When it is wrapped up in a cigar or in a cigarette or, it's vaporized. Because the majority of young persons, 58% of persons aged 18 to 25, use the vaporizer to deliver marijuana to them. Most young people. 35% of all users of marijuana are between 18 and 25. Younger persons. So marijuana is used by young adults mostly, and 58% of those young adults use the vaporizer. So most people know about the inhaled route. A lot of people are not aware that marijuana can be ingested, even though people now understand that marijuana is being baked in baked goods or in chewables or sweets. We call them gummies. Or it can be put underneath the tongue. It's called sublingual when we put it underneath the tongue. It can also be sprayed through the nostrils. It can be used rectally as a suppository. It can be rubbed on the skin as a gel or a lotion, or it can be used as a wax. The thing is, it goes into effect at different times based on the route of administration. That is what is important. That is what decides how it is. And if you look at slide number 14, you will see that the CBD has some effects and the THC has some effects. And then both of them together has some effects. It's so important for your viewers, Santi, to understand that the CBD, which is legal in sports,
CBD is legal, yeah.
yeah, has a more calming effect. And this is why in medicine, we use CBD to treat seizures, because what happens, Santi?
Treat seizures, you see.
Seizures,
Yeah,
yes.
yeah.
And for the listeners who don't know, seizures represent a condition in the body where the brain fires uncontrollably, right? And that causes the body to have abnormal movements, and so the person cannot control themselves. CBD can be used to calm this so that persons do not have seizures. CBD is very, very important in that effect because it calms the body, while THC allows the persons to be upbeat. And therefore, the reason why people love marijuana, Santi, is because the THC allows them to have energy. They feel like they can go. They feel like they can jump a wall or they can run faster. And that is why many persons take it. That's the THC. The CBD, people take it because before a race or before a fight in boxing or before an event, any event, it helps you to feel calm. In sports medicine, Santi, sports psychology is important. We talk to athletes because many athletes cannot perform well because they're very anxious before the race. In sports medicine, we understand that anxiety sometimes prevents a lack of relaxation from the muscles. And so if you're running a 100-meter sprint, the difference between running 9.7 and 9.8 is your ability to be relaxed. And so you won't lose the race. So in sports psychology, we try to talk to the people to see if they can be brought to a certain level of calmness so that in preparation for the race, they can do better. Athletes believe that marijuana can do this. They believe the CBD effect can do this. There are other athletes who want to be able to be upbeat, to be ready, to have energy. And they want the THC effect. The thing is, many athletes now, Santi, especially boxers, have to train hard. Santi, some boxers train 16 hours a day. And while they're sparring, they're being constantly hit over the body.
Chest and head.
Yeah. So they feel a lot of pain. So CBD and the THC have powerful anti-inflammatory effects. And boxers believe, and other sports athletes, that if I take the marijuana and it helps me with pain, I don't have to take other drugs like opioids, for example. One of the things we see in sports, and I remember in my country, I had to talk to the sporting associations. We had the young adolescents in school playing football matches every other day. I spoke to them and I said, physiologically, this is wrong, because they need at least 48 hours for recovery. Recovery is very important. And so they moved the matches, so now matches are played every 3 days to allow 2 days for recovery. The thing about marijuana is that the THC and the CBD component has been shown to aid in athletes' recovery. So many athletes want to use it to help them to recover faster.
Okay.
Why is this important, Santi? If you're at the Olympics, you have to do rounds, Santi. So you have to do the first round, the second round, the semifinals, and the finals. remember, Santi, the Olympics is over 8 days. You have to complete all your rounds within that time.
At least five bouts in 15 days.
And there you go. And you don't have the time to recover.
To recover, yeah.
So anything that can help you to recover
is a very good point.
Yes,
very good point.
Yeah. And if you can find something to help you to recover quickly, you would want it.
Yeah.
And so many athletes will try to use it for that purpose, Santi. But they need to understand something very important, because the next slide number 15, will show us something that we need to understand.
Amigos, olha só, nós estamos trabalhando para que cada vez mais o nosso canal melhore e apresente um conteúdo de qualidade. Nós temos custos, obviamente, porque nós temos um estúdio aí novo que nós montamos para poder oferecer melhores imagens, melhores condições técnicas. Nós temos pessoas que trabalham conosco, que dependem desse nosso trabalho. Enfim, tudo isso tem um custo e obviamente, o que a gente pede é uma ajuda através do nosso Pix, através do Apoia-se. Enfim, as pessoas que puderem colaborar e nos ajudar, realmente vai ser um diferencial para que a gente continue tocando o nosso canal com qualidade. Valeu! Tudo de bom, vamos em frente. Siga o Música, Medicina e Esporte. Compartilha, contribua, dá seu like, se inscreva e vamos em frente.
This slide shows us that when we test for doping, we test for THC. Very important. And when we test for THC levels, if the THC levels is above 150 nanograms per 150 nanograms, it represents a positive test. I want us to go all the way to slide number 7. Go to slide number 7, and we want to show that 150 nanograms per mil is what WADA uses. WADA uses, the World Anti-Doping Agency. 150 nanograms per mil is what they use in competition. This is a very important point, Santi, because marijuana, THC, is not banned outside of competition. It isn't.
Yeah, no.
It is in competition.
Yeah, it's only in competition. Yeah, that's why.
Yeah.
But what happens sometimes, and it happened to me once, and I won't tell which team, but it happened once. By the way, with the Brazilian athlete that went in a party together with Jamaican athlete. And they went in the same party, and they used marijuana. But it was 2 days, one day before the competition, because when the athletes go inside the village. He's under competition. Under competition conditions. So that's the risk. If you go to a party and you use marijuana, okay, if you're far away from the competition, no problems with doping. But if have left 1 or 2 days and then you use marijuana and you go inside the village, so you're gonna take in risk to be caught. So that's
Santi, you made such an important point.
Yeah.
Because athletes think that if I am not using marijuana, but I go to a party where marijuana is being used.
Yeah. But sometimes you are close to the person who is using marijuana.
Close to the person.
That's why the threshold.
Yes. We call it second hand. But we have realized that if you're in a club where there is high concentration of marijuana, then it can go into your system. So you have to be careful. But this 150 nanograms per mil, Santi, is in competition. And so that's important because if you use the time, if you're in the village, as you said, and the time is very close to your race or your fight or your event, it is very important that you avoid marijuana and you also avoid people who are using marijuana. It is so important. we go back to slide number 15, which is the slide we were, and this slide shows us, very important, Santi, that WADA removed the CBD from that prohibited list. We have said that before here in 2018, and so remember CBD
2018, right?
2018, yeah. And so that when we test for marijuana, we only test for THC.
Can see that, yeah.
We do not test for CBD. It is so important. So athletes must know that we're testing for THC, so do not use THC contaminated stuff. It is absolutely important, right? And there's one thing, Santi, if we go to slide number 19, slide number 19, we spoke about pain relief, recovery, we spoke about relaxation for marijuana, but let us talk a little bit about boxing, because we know Santi loves boxing. Mike Tyson, Santi, said that it helped him to focus. It said that he used marijuana. The listeners must understand that Mike Tyson, when he fought against Andrew Galata, he was banned because he used marijuana. He got a 90-day suspension, and he got a fine for $200,000 because he used marijuana, and his THC levels, when they did his doping tests after the match, was found to be illegal. He said that it also helped him to focus. Note that we don't have any proof for this scientifically. The scientific proof is with pain, is with recovery, and it is with relaxation. But we don't have any proof of focus. That's anecdotal. It just means that somebody said it, and we note it, and studies are ongoing to see if it really helps to focus for real. But, this is just what some athletes may have said. The challenge with marijuana in the next slide, in slide 20, is the curses, Santi. And we want all the athletes listening to note these curses very, very well. If you are a sprinter running a 100 meter race, your reaction time is very important. There is an athlete in Jamaica called Shelly-Ann Fraser. She is the greatest Olympic athlete for Jamaica in all times, and the greatest athlete at the World Championships too. Shelly-Ann Fraser.
Athletics,
yeah. She retired this year. Shelly-Ann Fraser, 100 meter sprinter, did it 200 a couple times, famous for the 4x100 meters also. She has one of the greatest reaction times ever seen. When that gun goes off, Santi, she gets up first, almost 100% of the times. And by 50, 60 meters down the 100 meter track, she is away. It's very difficult to catch her. THC interferes with your reaction time. Marijuana interferes with your reaction time. This is the issue. So you have to be careful, because if you slow that reaction time down, you will be left in the blocks. If you're a boxer and you cannot react quickly enough, a punch will hit you and put you on the ground. If you're a footballer and you have the ball on your legs and you cannot react quickly enough, the opposing person will take the ball from you and go and score. It is so important. Reaction time is important. Coordination and judgment is very important for all sports. And if you take a drug that is going to delay that, you are going to be in trouble. This is the challenge that we face with marijuana. As doctors, we know that the ability to breathe and the ability to have optimum lung and heart function is very important. Your ability to get to your maximum heart rate and your maximum oxygen concentration, absorption through your lungs. We have words for it in sports medicine, your VO2 max and your maximum heart rate, etc. These things are very important. We know that marijuana, because of the tarring of the lungs when smoked, Santi, decreases the ability to get to your maximum VO2 max. It has been shown. And therefore, it is going to impair your lung. You will have shortness of breath. You will have difficulty running. We also know that for every athlete, there is a formula for your heart rate. It's based on your age and so on, and your maximum heart rate, and your ability to reach that maximum heart rate from baseline also is significant in how fast you can move. Marijuana causes your heart rate to increase at baseline. When an athlete is fit, Santi, his heart rate is lower than the normal person's heart rate. So a fit athlete is going to have a heart rate anywhere between 50 and 60. A regular unfit person is going to have heart rate anywhere between 70 and 90. The problem with marijuana is that it causes your resting heart rate to increase. And when your resting heart rate increases, when you start to exercise, you get to your maximum heart rate quicker than normal. And because you get to your maximum heart rate quicker than normal, you don't have enough room to expand and move faster. Marijuana does that. So if your heart is already beating fast, when the athlete starts to really work hard, it causes the heart to overwork. So it has the potential to cause heart attacks, because your oxygen demand from your heart is more. And that is that's a problem with marijuana. It also has the potential to cause heart failure over long-term use. So it's very important that you understand. The last thing about marijuana when it comes to health is mental problems.
Okay, yeah.
There is absolutely no doubt that for especially persons with a family or genetic history of psychiatric challenges, with a family or genetic history of drug abuse, there's absolutely no doubt that marijuana has been shown to increase psychotic challenges.
That's important. That would be my next question. So
Yeah.
you're already talking about,
Right. Yeah. What we know is that 3 out of every 10 persons who use marijuana have something called cannabis use disorder. And cannabis use disorder is a condition that unfortunately causes persons to abuse marijuana.
Mm-hmm.
We have now realized that cannabis use disorder and the cannabis also now causes individuals to abuse other drugs. So you are 6 times likely to abuse alcohol if you abuse cannabis. You're more likely to abuse cocaine if you abuse cannabis. You're more likely to abuse LSD, heroin, if you abuse cannabis. So we realize that persons who now abuse cannabis are abusing many other drugs.
So it's true that it's an open door for other drugs.
It is.
Because, we have this discussion here. Oh, it's not true. Oh, there are authors that they tell the opposite thing. But I always believe that happens. So you're the specialist. And so you are now just telling that, yes, it's an open door for other drugs.
We have
absolutely.
We have studies on it. We have journals, studies.
Yeah.
We have level 1 studies. Yes, there's absolutely no
absolutely,
doubt.
Yeah.
We see it.
Okay,
we see
thank
it
you.
in our society. We have to deal with it. And we have many persons who are dealing with it. And this is why it is so important that we understand the drug. We understand persons who are going to use the drug. And so people just have to be very careful. The next slide, Santi, is quite interesting because for an athlete, if you're going to take marijuana, then you have to consider the legal and the ethical implications. Why, Santi? Because if you are suspended, if your THC is found to be 150 nanograms per mils or greater, you can face a fine, you can face a disciplinary hearing, you can face a reprimand, which means you're publicly chastised, Santi, in
Publicly.
front of everybody. And when that happens in front of everybody, Santi, imagine somebody chastising you publicly in front of all of Brazil, in front of all of the world.
Yes, embarrassing, huh?
It's embarrassing. It's embarrassing. And so your reputation and your image goes. And remember, as an athlete, your reputation is very important. It's very important how people see you. It is crucial for boxing success. It is crucial for athletic success. It is crucial. Remember, when an athlete is seen as a cheat and a drug user, the whole world looks at him differently. Whole world looks at him differently. So it's very important that you do not allow it to negatively affect your career. It's very important. You see, the next slide, Santi, is probably the best and the most
The
important
blessing
one.
and the curse
Yeah,
are in one
is
package.
in one package. What do you do if you want something, but the good and the bad comes as one? You know, this is what happens with marijuana, because a lot of persons love to feel good. In general, in life, you like to feel good, Santi. You love when your children, Santi, when you go to one of your children and you say, you were a good girl today, she feels good. Okay? But Santi, what if you say you were a good girl today and immediately after you say, and you are a bad girl?
Yeah.
That doesn't help.
Doesn't help.
It doesn't help.
Yeah.
Because her confidence is going to go.
Yeah.
And this is what marijuana is. It is saying you're good in one package, and in the same package, it is saying you're bad at the same time. Because the part that makes you feel good is in the THC, and the part that takes away, the pain and does the recovery and the anti-inflammatory effects is in the same THC. And so the question is, how do we work around that? How do we advise the athlete in the next slide to make an informed decision? We want athletes who are listening to us today to know how to make an informed decision. The first thing in the next slide is to use or not to use. You must decide if it is good for you.
Yeah, that's a question we are putting here on the table to people.
Yeah.
It's your choice.
It's your choice.
Yeah.
It's your choice. You work with your doctors, your physiotherapists, your parents, those who love you, those who love your career, your advisors. Work with them. Make a decision. Make an informed decision. It's not for Santi, or it's not for Dr. Santi or Dr. McDonald to tell you what to do.
Yeah.
But it's for you to make a choice, whether you're going to use or not to use. You must understand that the next slide, Santi, shows the different bodies that are responsible for testing, and or some of them, because there are many different bodies. But you must understand the ones in your area, your local commissions. So I must understand. I'm a member of the Pan American Anti-Doping Commission. I must understand what Pan American Anti-Doping Commission says. I must understand. The Pan American Commission is very important. They govern over the boxers in Jamaica, for example. We follow your rules. Therefore, because I am the sports medicine physician for the Jamaican boxers, I must advise them. I'm sports medicine physician for the boxers in the army. I must advise them. I must know as a doctor what is legal. I must know that if they test for THC 150 nanograms per mil, they are going to face an adverse analytic finding. So I must advise them. the athletes themselves, Santi, must know. You're going into a competition, what is banned and what is not banned. That's the first and most important thing. Because it doesn't matter, Santi, what you think about marijuana. If you're going into a game and marijuana is banned and you have a positive test, you're out.
Yeah, but Dr. McDonald, the truth is that the insanity in sports athletes and sports, it reflects on the whole society.
Yes.
You know, sports is part of the society, so that's why we have policy. We're talking clean sport. We're talking ethics. We're talking health damage. So you see, everything what happens in sports, it happens in society. That's why we're putting this to the discussion to people.
Yes.
Because we're showing sports, but you have to think about your house, about your kids and your friends and everything else.
Yes.
Don't you think? Don't you think about that?
Of course, Santi. Of course. This is what, we do every day. The thing is, Santi, we're talking about sports now, but you're absolutely right. As a doctor, a general doctor, a regular doctor, I have to deal with persons who have marijuana addiction.
I have to deal with this problem all the time. Yeah,
all the time. Persons come to my medical center now with the symptoms of what you call acute marijuana intoxication. That means their heart is racing. That means they're having hallucinations.
Yeah.
They're running from who they cannot see. They feel like they're dying. They feel like their heart is coming out of their chest. All of these persons I have to deal with. And so it becomes a situation now where they are admitted to my emergency department, and we have to now be treating them with other medications to solve this problem. So it is a bigger problem than just athletics. And this is why the policies in athletics are created to protect the athlete. That's the most important thing. Yeah. I tell you, Santi, one of the things, the next slide is so important because it allows the athlete to make an informed decision, and the athlete must now decide that if they are going to use marijuana, then they must receive a number of things. They must be clinically evaluated. What does that mean in medicine, Santi? That means that we have to do a medical history. It means that the athlete has to be prepared to be asked questions by the doctor. The doctor is going to be asking them about their health. The doctor is going to also examine that athlete, heart and lungs especially, to see where it is. The doctor is going to do some investigations on those areas to see if they are already compromised, because we know what marijuana can do. We said it before. The doctor is going to take a psychiatric history, Santi. It's the psychiatric history is very important for two reasons. For the personal athlete to say, do you have any psychiatric challenges? It is very important to ask the athlete, do you have any history of drug abuse? And the second part, Santi, is for the athlete's family history. Do you have any family members with psychiatric problems, with medical problems? Because, Santi, you may not immediately have a heart problem, but if your mother has a heart problem, it may mean that you are more likely to get it. Santi, you may not immediately have a psychiatric problem, but if your father had bipolar disorder or schizophrenia, which are psychiatric challenges, it means it is in your family, Santi. And what it means is that the moment you start using marijuana, immediately it sends you there, because you already have a family history.
Okay, this is an important issue. Yeah.
And a propensity, right, which means a likelihood to now go into a psychiatric distress when you use marijuana. you are more likely than the other person because you have a family history. So this is why you must get clinically evaluated.
Yeah.
The next thing you must do, if you're clinically evaluated and you pass that test, because if you're clinically evaluated and you don't pass the test, you shouldn't use it. That is what we advise. But let us say you pass the test, you go now, you must decide what formulations you're going to use. We spoke about the formulations before. And the formulations, the most important thing about the formulation, Santi, and many persons must know, the formulation speaks to the we could go back to slide 14. The formulations is very important, Santi, because the formulation speaks to the ratio and the concentration of CBD to THC. Now, I'm going to give you an example, Santi. We use a CBD predominant formula to treat seizures because it is the CBD that treats the seizures, not the THC. We have realized that the higher the concentration of CBD is, the more you get the calming effects. And the higher the concentration of THC is, the more you get the intoxicating effects, or the effects that make people addicted. Or athletes who are listening, Santi, has to remember that it's THC we test for in the drug test. So if you're using THC, you're going to be in trouble. Okay? Now, it is so important, if we go back to the slide we were before, which is slide number 26. When you look at the specific formulation, you must know the risk and the benefits of that formulation. And here are the risks. Based on the dose of this formulation, am I going to return a positive test? Very important. Based on the dose of this formulation, am I going to become addicted? Based on the dose of this formulation, am I going to be at risk for opening the doors to other drugs? Based on the dose of this formulation, am I going to be likely to have cannabis use disorder? These are the questions you have to ask. The route of the administration is very important, right? Because the route of the administration, right, shows several different things. The route of the administration, Santi, shows persons, and if you go back to slide number 12, if you go back to slide number 12, you will see that the route of the administration is very important. Very, very, very important, depending on the type. We spoke about that before, but here is what now is significant. If you go to slide number 16, then you will see why the route is very important. Santi, if you take it through oral, then you will see that for 2 to 24 hours, it is detected for up to 72 hours. So you spoke about the guy that was inside the athlete's village. If you're inside the athlete's village and you take some saliva, some marijuana coming through your saliva or through oral fluid, then if you have 3 days up to your drug test, you're in trouble.
Yeah. 3 to 10 days in your urine, which is the sample that they take for doping.
Excellent.
Yeah, they take blood too, but
excellent.
I think urine is much more.
Urine is the test that we take. You're absolutely right. And if you use very, very high doses, it can be up to 30 days or longer. Yeah. So if you're in competition, right, we don't do hair tests, we do urine tests. So if you're in competition, Santi, remember, it's in competition, not out of competition, and you're going to use this, and you expect to use it within a month of competition, you can be in trouble.
Yep.
It is so important. This is the understanding that I don't think athletes understand. Yeah. They don't understand this. And because they don't understand this is how I talk to some of the athletes in Jamaica. And I said, you can't be smoke. When is your match? When is your boxing match? When is your race? When is your this? When is your that? And they say, oh, marijuana helps me and I feel good. I said, yeah, but when is your match? And they said, okay, my match is next month, December. I'm saying, you're going to be in trouble.
And it depends of other factors like metabolic system.
Exactly.
I think you're going to talk about, right?
Yes. So since you spoke about it, let's talk about it. Next slide. The next slide that will tell you that your frequency of use, the amount you use, Santi, the route it goes through, yes, Santi, the potency, how strong the THC is. Okay. You said it right. The individual's metabolism,
excretion,
how they excrete, the type of test. We spoke about that. Urine test was the one we use. Females tend to keep the marijuana more in because they have more fat. So marijuana, when it goes into your body, Santi, it goes into fat. It's not only processed through the...
You said women.
Yeah.
They're going to get mad at you.
Yeah.
You know, we cannot talk about those subjects with women.
Well, let me say.
Sorry for that.
Yeah, tell the women that they're the most beautiful persons in the world, and you know we have high regards for them. But the marijuana stays in their body a little bit longer, so they have to be careful. The reason why we talk about body mass index, because you know body mass index in general, we understand that somebody can be muscular and they have a higher body mass index than somebody who is not muscular, because body mass index is weight in kilograms over height in meters squared. We understand that. However, understand that in general, for somebody with a higher body mass index, they tend to have more fat in general. And this is why the higher the body mass index, usually the longer the marijuana stays inside of you, okay? Persons who are unhealthy tends to keep the marijuana longer. And we spoke about genetics. Some persons are born with the ability to metabolize faster, and some people to metabolize slower. So that's where genetics is concerned. So it's so important to understand the factors, right? Back to slide 26. The timing is going to be very important. Timing, so important. Again, remember that marijuana is for in competition, right? We know that out of competition. So based on what we just told you, if you're going to use, be very calculated, Santi, be very sensible that you use it outside of competition. And while it is hard, Santi, it is still possible to get a therapeutic dose exemption, a TUE. One of your doctors, Santi, asked me about that in the Congress. And very good question from the doctor, very educated question. And that doctor said that, you know, he found out that in many different countries, it's so hard to get a TUE. It is hard. It is hard. I will agree that it is very hard to get a TUE for marijuana, because you have to show, to get any TUE at all, that there are no other options. There are no other options. So if the patient wants it for pain relief, you have to show that there are no other pain relief, pain tablets that can help them. You also have to show, Santi, that the patient needs it because it takes the patient away from his baseline or her baseline, and when they use marijuana, it brings her back to her baseline. So you have to show that. That's something that is difficult to show also. Yeah. And you also have to show that it will not affect their performance.
And we have to consider that high performance athletes, they feel pain all the time.
Exactly.
Yeah.
Exactly.
Mainly after many years of training and competition. We have to consider that.
But of course.
Yeah. And WADA keep changing the code every year, and they're taking out pain relievers all the time. So we are almost with no options to treat those athletes. So we have to discuss better this issue. And now it changed. change now in January.
Yes.
They're gonna show a new list,
Right.
right? They're gonna publicate a new list,
Right.
and I don't know. I have to study, but I don't know if they changed something. But we have to stay to pay attention about that issue, right?
Yes. That's very, very important. Regulated versus unregulated. We spoke about that before, and regulated, Santi, speaks to marijuana that has been tested,
Yeah.
that has been tested for contaminants, that has been tested for dose, that has been tested for purity, and that has been tested to ensure that if you are going to take a CBD,
Yep.
then it's only CBD. So it's so important. Unregulated one, Santi, is not good. And the next slide is going to make a very important point that regulated is always better than unregulated.
Okay, good. That's a good question, and then a good affirmation, and it's a good sentence.
Yes.
Yeah, you have
Yeah.
to let it very clear.
Yes.
Not against, not a law. Go to
Yes.
jail. Not
Yes.
that, but
Yes.
you have to regulate based on facts, on medical facts.
Exactly. And so, regulated is good because the next slide shows that we know the THC to CBD ratio. We know the dose, we know the route of administration, and we know the timing. These are the things I've been asking the athlete to learn: the dose, the route, the timing based on when you're going to go for your event. Okay? We know that some of the lower doses in regulated will not or less likely to turn up an adverse analytic finding. We know, Santi, that if you believe that you want to get good from it, then we can take our time and adjust the dose so that you do not have an issue until you experience relief. We know, right, for the next slide, that unregulated is bad. Unregulated is contaminated with all sorts of things, pesticides, heavy metals, different microbes, bacteria, other drugs that are banned by the different anti-doping commissions. We know that regulated is more likely to unregulated is more likely to cause adverse effects. We know that it's more likely to give you a positive test when they test you for doping. We know that unregulated is between 10 to 20% of THC. What does that mean, Santi? It means for every 1 gram of whatever you're using, it's like 100 to 200 milligrams of THC that is in it. That's a lot. That's definitely going to return a positive test. So it is not good to just go and buy marijuana on the street.
Good.
Let's make that clear. It's not good to just go and get it on the side of the road from a friend. Let's make that clear. It's not good to not know where you're getting it from. And the problem, Santi, is the unregulated ones are the ones that are available.
Yeah.
It's easy to get. It's easy to get. Santi, you can go get some unregulated one now if you want. Right now.
Yeah.
It's easy.
Yeah.
It's easy. But those are the bad ones. Those are the ones.
They mix with things and you put everything in it.
Right.
Yeah.
Right. So my final question to you, Santi, and all of your listeners is on the last slide.
You
The
know
next
that
slide.
here in Brazil,
Yeah.
I've heard once that they put even cow waste inside, mixed with the
Yeah.
with marijuana. Oh,
Yeah.
it's terrible.
It's
They mix
terrible.
everything in it.
They mix everything. So my final question to everybody, Santi, is it? What is the verdict? What do you think?
Yeah.
Is it a blessing or a curse? Santi, I want all your listeners to decide.
Yeah, and you decide.
Yes.
Yeah.
Yeah.
Dr. Andre.
Yes, sir.
Yeah, many information, and I think it's useful for people. I hope people reflect on it, and we're talking with a specialized doctor. Is a conversation between doctors, and we see people every day,
Yes.
all kinds of people, all kinds of athletes, all kinds of behaviors, and we have to, to help them.
Yes.
And I don't know how to thank you.
Yes. Yes.
Yeah, and your visit in our country was very useful.
Yes.
We took profit of it, and thank you, my friend,
welcome,
and we have to say that
Yes.
you are here in a very important date here for us,
Yes.
which is November 20.
Yes.
This is is a conscientization
Okay.
against racism.
Yes.
Yeah, I
yes,
told you about
did
that.
tell me
Yeah,
that,
and then
and I was very happy. Yes.
and you are here, and
Yes.
this is a very representative date
Yes,
for us,
yes.
a representative happening to us,
Right.
and here and talking about
Yes.
a very important issue.
Yes. Yes.
And I
very
hope you can
important.
come someday again.
I will, Santi.
And,
I enjoyed Brazil, Santi. I am enjoying it still, and I really, really, really love it. I will be back.
Yeah, you're
Yes.
invited.
Yes.
E para você que acabou de nos acompanhar, que a coisa fique bem clara, né? Nós somos aqui como médicos, nós estamos aqui como pais de ninguém, como pregadores de algum tipo de moralismo, e também que os haters que eventualmente mandem mensagens entendam que nós estamos aqui passando mensagens e querendo o bem das pessoas. Nós não queremos nada mais além disso, que aliás é para aquilo que nós médicos fomos treinados, né? Nós somos treinados exatamente para isso, para salvar vidas, para ajudar as pessoas e para trazer o melhor da qualidade de vida para esses seres humanos que nos procuram. Até a próxima, e não se esqueça de dar seu like, é importante que você realmente nos acompanhe, nos ajude, para que a gente possa trazer conteúdos tão riquíssimos quanto esse que o Dr. Andre McDonald nos trouxe. Aliás, McDonald is a very suggestive name, right? it could be a very good sponsor for us. Tchau, pessoal. Um abraço aí. Tudo de bom aí. Jamaica is a lovely Caribbean country with cheerful people, vibrant music, contagious energy, and a unique culture such as Rastafari, which strongly influenced Brazil, especially in music, with the unmistakable beat of reggae through Bob Marley and Peter Tosh. In addition to that, produced a world hero in sport, Usain Bolt. The cuisine is exotic and tasty. Despite controversies, there is much to learn and discover through people like Dr. Andre McDonald, a military man, doctor, musician, and benefactor, who dedicated himself entirely to the service of his country in a tragedy that recently struck beautiful Jamaica. Olá, amigos, seguidores, inscritos e apoiadores do nosso canal. Como vocês sabem, o nosso canal Música, Medicina e Esporte sempre procura trazer um conteúdo de qualidade, falando sobre curiosidades, utilidade pública, informações, e, enfim, tudo aquilo que possa contribuir para o entretenimento e o nosso dia a dia. Mas para isso nós temos um custo, nós temos um equipamento que a gente precisa ter no nosso estúdio, as pessoas que trabalham conosco, que obviamente também dependem desse nosso trabalho, e o YouTube ainda não monetiza adequadamente o nosso canal. Então, para isso nós precisamos da sua ajuda. Vocês estão vendo aí no nosso vídeo a chave Pix e o QR Code para aqueles que quiserem contribuir, e na descrição do vídeo nós temos o link do Apoia-se. Qualquer valor, qualquer quantia vai ser muito útil para que possamos continuar fazendo do nosso canal um veículo importante para as pessoas. Agradeço demais e não se esqueça, contribua para o Música, Medicina e Esporte. Vamos em frente.